Lower back pain. It sneaks up on you, slows you down, and can make even the simplest tasks feel impossible. But what if I told you that you don't need strong medicine, expensive therapy, or risky surgery to feel better, starting today? In this video, I'm going to show you easy, daily solutions that actually work to stop pain fast, heal your back, and prevent it from coming back. Stick around, because by the end, you'll have a simple routine you can start today, and your back will thank you. Okay, let's talk about a question almost everyone asks at some point. When should you actually worry about low back pain? First, here's the good news. Most back pain isn't dangerous. That's right. Almost everyone experiences some kind of back discomfort in their lifetime. So if you've ever felt that annoying stiffness or ache, you're definitely not alone. Even when the pain feels intense, here's an important fact. It often improves within a few weeks. Your body is actually very good at healing itself, especially when you keep moving, stretch gently, and practice simple self-care. Now, serious cases, the ones that might need urgent medical attention or even surgery, are rare. So while it's smart to stay aware of warning signs, most back pain doesn't mean something is seriously wrong. Takeaway for you: don't panic if your back hurts. Focus on gentle movement, strengthening, and healthy habits, and you'll give your spine the best chance to recover quickly and stay strong for the long term. Remember, knowing the facts is the first step to feeling better, and that's exactly what we're here to do. Now, while most back pain is not dangerous, there are a few red flags that mean you should see a doctor right away. First, if your back pain started after a fall or injury, don't ignore it. Even if it seems minor at first, it could indicate something more serious. Next, pay attention to numbness or weakness in your legs. If your legs feel heavy, tingly, or start giving out, it's time to get checked. Your nerves could be affected. Another warning sign is trouble controlling your bladder or bowels. This is not normal and needs immediate medical attention. If you're experiencing unexplained weight loss, or you have a fever or feel unusually sick, your body could be signaling something more than simple back pain. Certain medical conditions can increase your risk for serious problems too. For example, if you're taking long-term steroids like prednisone, have diabetes mellitus or a weakened immune system, or have a history of cancer or osteoporosis, you should be extra cautious. Takeaway: most back pain is temporary and manageable at home. But if you notice any of these red flags, don't wait. Call your doctor or get medical care immediately. Early action can make all the difference. Remember, knowing the difference between normal back pain and warning signs is key to staying safe and healthy. Even though most back pain isn't dangerous, there are a couple of signs you should never ignore. First, if your pain is so severe that you can't do your daily tasks, getting dressed, walking, or even sitting comfortably, that's a red flag. Don't push through it thinking it will magically go away. Second, if your pain isn't improving after 4 weeks, it's time to get evaluated. Most back pain starts to get better on its own within that time frame, so persistent pain could mean something more is going on. The bottom line: stay calm. The majority of low back pain does improve naturally. But here's the key: don't wait if warning signs appear. Early evaluation by a healthcare professional can lead to safer and faster recovery, getting you back to your daily life with less worry and discomfort. Remember, listening to your body and acting early is one of the smartest steps you can take for your back health. Alright, let's break down the key parts of your back in a simple way that actually makes sense. First up, Vertebrae. Think of these as your back's building blocks. Imagine stacking coins on top of each other. That's how your spine is built. Each vertebra isn't just a solid block. It has a tiny opening in the center, and when all these bones are stacked together, they create a protective tube for your spinal cord. This is super important because your spinal cord is like the main highway for messages between your brain and the rest of your body. Next, we have the discs, your body's natural shock absorbers. These are soft, rubbery cushions sitting between each vertebra. They allow your back to bend, twist, and move smoothly, while keeping your bones from rubbing against each other. Without discs, even simple movements would feel like grinding metal. Takeaway: your spine is an amazing combo of strong building blocks and flexible cushions, designed to support your body and protect your nerves. Understanding how it works is the first step to keeping it healthy and pain-free. Let's keep breaking down your back, because understanding it is the first step to ending pain for good. First, meet the spinal cord and nerves, your body's electrical highway. The spinal cord runs safely inside the vertebrae, like a protected superhighway. Between each vertebra, nerves branch out, carrying messages to and from your brain. These nerves control everything: your arms, your legs, even your organs. This is why back problems can cause more than just back pain. Sometimes you might feel leg pain, tingling, or even bladder issues, all because of how these nerves connect your spine to the rest of your body. Next up, the muscles, tendons, and ligaments, your back's soft tissue support team. They work together to stabilize your spine, keep it aligned, and protect it from injury. Think of them like the ropes and pulleys in a crane, holding everything in the right place while allowing smooth movement. Why this matters: when you understand the parts of your back, you understand your pain. And when you understand your pain, you can treat it smarter, move better, and recover faster. Knowledge isn't just power, it's relief. Now, let's tackle one of the biggest questions everyone asks: what really causes low back pain? The truth is, most of the time, there isn't one clear cause. Even doctors sometimes can't pinpoint an exact reason why your back hurts. And that's okay. It doesn't mean you're imagining it. Here's the thing: while the exact cause may be tricky to identify, common patterns often explain most back pain. Things like poor posture, muscle weakness, repetitive movements, or even sitting too long can all add up over time. The key takeaway: you don't need to know the exact cause to start feeling better. Understanding these patterns is enough to guide simple daily habits and exercises that relieve pain and protect your back for the long term. Bottom line: low back pain is common, complex, and sometimes mysterious. But with the right strategies, you can take control, reduce pain, and move freely again. Alright, let's start with the big one. The most common culprit behind lower back pain: muscle strain. You know that feeling when you bend the wrong way or lift something a little too heavy and suddenly, bam, your back protests like it's got a mind of its own. Yep, that's a classic muscle strain, or as people often say, I threw out my back. Here's the thing: it usually happens after lifting, twisting, or just a sudden movement you didn't even think twice about. 1 second you're fine, the next, you're wincing, bending sideways, and wondering how you'll survive the rest of the day. And the pain, it often starts instantly right after the activity, like an unwelcome alarm clock going off in your lower back. But don't worry. Later in this video, I'll show you easy daily solutions that can calm this pain fast and help prevent it from coming back. So, If you've ever experienced that sharp, yanked back feeling, you're definitely not alone, and it's time to take action. Okay, so we've talked about the classic muscle strain, but your lower back pain could also be caused by a few other things. Don't worry, I'll break them down in plain English, so it all makes sense. First up, disc problems. These are when the discs in your spine, those soft cushions between your bones, get damaged, bulge, or even tear. When that happens, they can press on nerves and, yep, that's why sometimes your pain shoots all the way down your leg. Next, we have spinal arthritis. Think of it as the wear and tear on the joints in your spine. Over time, those joints get stiff and achy, making movement uncomfortable. Then there's bony overgrowths, also called bone spurs. Basically, extra bone grows where it shouldn't and can crowd or irritate nearby nerves. Ouch. Sometimes, the problem is a vertebra out of alignment. When one of the bones in your spine shifts just a little, it changes how your whole back moves, and your body starts complaining. Another one is spinal canal narrowing, or stenosis. This is when the space around your spinal cord gets tighter, putting pressure on your nerves and causing pain, numbness, or tingling. Finally, there's tumors or infection. These are very rare, but important to rule out if your pain persists or doesn't respond to normal treatments. So, while most lower back pain is caused by things like muscle strain or arthritis, it's important to understand the full picture, because knowing what could be happening is the first step toward relief. Now, let's tackle a big question that pops into everyone's mind when their back hurts. Do you really need an X-ray or MRI? Here's the truth. Most people don't. That's right. X-rays, CT scans, MRIs, they are rarely necessary for typical lower back pain. In fact, most back pain naturally improves within just a few weeks without any fancy imaging. So if you're stressing about a scan, take a deep breath. You're probably fine. So when do doctors actually order imaging? Only when something unusual might be happening. Imaging is reserved for special cases, not your routine sore back. That way, you save time, money, and avoid unnecessary worry. And if you don't get an X-ray or MRI, don't panic. Your doctor can still figure out a lot by 1. Watching how you move and bend. 2. Asking detailed questions about your pain. And 3. Checking for specific red flag symptoms. The bottom line, most of the time, your back pain can be managed without a single scan. And that's great news, because it means you can focus on what actually helps. Easy daily solutions that relieve your pain and get you moving again. Now, here's something that might surprise you. Doctors can often figure out what's wrong with your back just by talking to you. Sounds almost like magic, right? But the truth is, your symptoms tell a story. And sometimes, your description alone gives doctors more insight than any test could. Let's break it down. What your pain pattern reveals. Pain after lifting or twisting. Chances are, it's a muscle strain. The classic, I threw out my back scenario. This is exactly the type of pain that usually improves with simple daily movements and care. Pain shooting down the back of one leg. That could be a pinched nerve, often caused by a bulging or torn disc. You might have heard this called sciatica. That sharp, electric-like pain traveling down your leg is your nerve waving a red flag. Pain down both legs. This is a little different. Both legs being affected could signal narrowing of the spinal canal, usually from bony overgrowths pressing on nerves. This is less common, but knowing the pattern helps doctors target the exact cause. The bottom line, Telling your doctor about your pain in detail is powerful. It's like handing them the map to your back, so they can guide you straight to relief without unnecessary tests or worry. And here's the best part. You don't need fancy scans to start feeling better. Understanding your pain is step one toward ending it, and that's exactly what we're going to tackle next. Alright, now we get to the good news. How to actually treat lower back pain quickly and safely. Here's the first thing to know. Most back pain isn't serious. And the majority of the time, it gets better with simple, everyday care. No fancy gadgets, no expensive procedures. Step number 1. And this is the number one best fix. Stay active. I know, when your back hurts, the first instinct is to lie down and do nothing. But here's the twist. People recover faster when they keep moving. Even gentle movement helps your muscles stay strong, your joints flexible, and your body from stiffening up. Now, that doesn't mean you have to run a marathon. If the pain is really severe, a short rest of just 1 to 2 days is okay. But after that, it's time to get back to walking, stretching, and your normal daily routines. A few quick tips while you're staying active. Avoid heavy lifting or intense sports until your pain improves. Take frequent short walks instead of lying down all day. Focus on light movement that feels comfortable, not painful. The key idea: motion is lotion for your spine. Keep it moving, and your back will thank you. Step number 2 in treating lower back pain. Use heat for relief. When your back muscles feel tight, achy, or in a spasm, heat is like a magic relaxer for your muscles. A simple heating pad or warm wrap can make a huge difference, helping to soothe tension and ease stiffness almost instantly. Here's how to do it safely. Stick to low to medium heat. You want it warm, not scorching. Apply it for 15 to 20 minutes at a time, and give your skin a break before reapplying. Focus on the areas that feel tight or achy, letting the heat melt away the tension. Think of it like giving your back a cozy little hug. It relaxes the muscles, calms spasms, and actually helps your body start healing faster. Pro tip: you can combine this with gentle movement or walking afterward. Heat first, move second. To maximize relief and get your back to normal even faster. Lower back pain is something nearly everyone experiences at some point, and it can feel like it's taking over your life. But the good news: sometimes, relief is just a few simple steps away. Today, let's talk about one of the easiest ways to start easing your pain: over-the-counter medicines. Now, before you panic or reach for anything in your medicine cabinet, here's the simple rule: start smart. And the first go-to is usually NSAIDs. That's short for non-steroidal anti-inflammatory drugs, basically medicines that reduce inflammation and pain at the same time. The most popular NSAIDs you've probably heard of are ibuprofen, like Advil or Motrin, and naproxen, like Aleve. These are the ones that often work better than plain painkillers like acetaminophen, Tylenol, paracetamol, or Panadol, especially when your back pain is caused by muscle strain or inflammation. So why do they work so well? Imagine your back muscles are like a rope that's been twisted and tugged too hard. NSAIDs calm down the inflammation around those muscles and joints, letting them relax, and giving you noticeable relief, often in just a few hours. Quick tip: always take them with food or a little water. It helps protect your stomach and keeps the medicine working effectively. And here's a pro move: combine this with gentle stretching or light movement. NSAIDs can take the edge off, but moving safely helps your back heal faster and prevents future flare-ups. Think of it as a 1-2 punch, medicine plus motion. Coming up, we'll show you another simple, daily trick that works even if painkillers aren't enough. So stay tuned, because your back is about to thank you. Sometimes, no matter what over-the-counter medicine you try, that nagging lower back pain just won't quit. And that's okay. You're not alone, and it doesn't mean something is seriously wrong. It just means it's time to take the next step. If your pain isn't improving after a few days of NSAIDs or acetaminophen, here's what you should do: talk to your doctor. Yes, it might feel obvious, but too often people try to tough it out, and that can actually make things worse. Your doctor might suggest something called a muscle relaxant. These medicines can help calm tight muscles and spasms that OTC drugs sometimes can't reach. They're especially useful if your pain is coming from tense muscles rather than just inflammation. But here's the important part: muscle relaxants aren't always recommended for everyone. If you're 65 or older, doctors are usually very cautious because these medications can sometimes cause confusion, dizziness, or trouble urinating. So it's crucial to be honest about your age and health history. Bottom line, if over-the-counter meds aren't enough, don't just suffer in silence. A quick conversation with your doctor can get you the right help, and get you moving and living comfortably again. And if you think medicine is the only answer, think again. Coming up, we're diving into simple, daily habits and stretches that can relieve pain without a single pill. And you can start today. Sometimes, even after trying medicines and simple stretches, your lower back still feels stubborn. Don't worry. You don't have to just live with it. There are extra treatments that can help your back feel better, fast. Now, these aren't cures for the underlying problem, but they can make a huge difference in your comfort and mobility. First up, spinal manipulation. Think of it as a gentle reset for your back. A trained professional, like a chiropractor or physical therapist, will make precise, controlled adjustments to your spine. These adjustments can improve your mobility, reduce pain, and help your muscles and joints move more naturally. But here's the key: always talk to your doctor first before trying it. You want to make sure it's safe for your specific back condition. Next, let's talk about something a little different: acupuncture. Tiny needles, big relief. It's part of traditional Chinese medicine, and here's how it works. Acupuncture may help by blocking or reducing pain signals in your nervous system. Many people feel noticeable relief even after the first few sessions. It's a low-risk option that can complement other treatments, especially if your pain is stubborn or chronic. And then there's massage therapy. A skilled massage therapist can loosen tight muscles, improve blood flow, and reduce tension, especially if your back pain is stress-related. Massage can also reduce stiffness, help you move more easily, and make daily activities much more comfortable. Think of it as a reset button for your muscles and stress levels combined. So, while these extra treatments may not cure the root cause of your back pain, they can give you fast, real relief, letting you move, work, and live without constantly thinking about your back. And the best part, you can combine these with simple daily habits and stretches to get even better results. Your back doesn't have to hold you back. Lower back pain can make even simple tasks feel impossible. But here's the truth: staying active is actually one of the fastest ways to heal. That's right. Movement is medicine, and the right kind of activity can reduce pain, loosen stiff muscles, and speed up recovery. Step 1. Stay active, but gently. You don't need to run a marathon. In fact, being bedridden can make back pain worse. Gentle movement is what tells your body, hey, we're healing, and we're staying flexible. Here's how to do it. Use heat therapy, like a warm compress or heating pad, to relax tight muscles before moving. Combine it with light stretching to slowly lengthen and loosen those muscles. Rest only when necessary, because too much inactivity slows healing. Think of movement as your back's best friend, not its enemy. Step 2. Build smart, daily habits that keep your back strong and pain-free. Some simple examples include taking short, frequent walks throughout the day, even just around your home or office. Doing easy mobility routines, like gentle hip rotations or cat-cow stretches, which keep the spine moving without strain. Keeping your spine warm and flexible. This can be as simple as wearing supportive clothing, a light wrap, or using a heating pad to help your muscles stay loose. The secret: combine movement, heat, and smart daily habits, and you're giving your back exactly what it needs to heal faster and feel better. Over time, these small, consistent actions add up to big relief and a stronger, more resilient back. Your back doesn't have to hold you back. You can take control starting today. Lower back pain can feel like it's taking over your life, but the truth is, there are proven ways to reduce pain and help your back heal faster, without relying on strong medications or risky surgery. Let's dive in. Step 1. Guided strengthening, often with the help of a physical therapist. Here's the deal. Learning targeted stretches and core building exercises can stabilize your spine, improve mobility, and prevent future flare-ups. Some of the best options include walking, simple, low impact, and perfect for daily consistency. Swimming supports your body while strengthening muscles. Exercise bikes, gentle on the back but great for core engagement. And here's a bonus tip. Yoga and Tai Chi are excellent for improving balance, flexibility, and reducing pain. The key is to find activities you actually enjoy. Because if you like it, you'll stick with it, and consistency is everything for long-term relief. Step 2. Reduce stress to reduce pain. It might sound surprising, but stress and tension can make back pain worse by keeping your muscles tight and your nervous system on high alert. Here's what works. Mindfulness and relaxation training help calm your nervous system. Meditation can ease the tension that builds up in your back. And if pain is causing anxiety or depression, don't ignore it. Talk to your doctor. There are treatments that can help you feel better physically and emotionally, which can speed up recovery. Finally, let's talk about the big interventions, injections and surgery. Injections. These can help in specific cases, like inflammation around a nerve, but they are usually temporary relief rather than a cure. Surgery. The good news is that surgery is rarely needed. Only a small percentage of people with back pain actually require it. So for most of us, non-invasive strategies, exercise, stress management, and smart self-care are the game changers. So, remember, strengthen your core, stay active, reduce stress, and embrace daily habits you enjoy. These steps don't just ease pain. They help your back heal faster and stay strong for life. Your back doesn't have to hold you back. Start with these simple, proven steps today, and feel the difference in how you move, sleep, and live. Just when you finally feel your lower back starting to feel better, it comes back. Frustrating, right? The truth is, recurring back pain is often preventable with a few simple, daily habits. And the best part, they're easy to do and take just minutes a day. First, stay active every single day. Think of your spine like a strong rope. You need movement to keep it flexible, strong, and ready for anything. Simple daily strengthening and stretching exercises aren't just for recovery. They're long-term protection against future flare-ups. Even a 10-minute routine of stretches, gentle twists, or short walks can make a huge difference over time. Next, let's talk about lifting. A lot of back pain happens in a split second, just from picking something up the wrong way. Here's the rule. Lift with your legs, not your back. Keep objects close to your body. Avoid twisting while lifting. Think of it like giving your back the VIP treatment. It deserves proper support every time you pick something up. Another big culprit is staying in one position for too long. Sitting at a desk, standing while cooking, holding a phone in the same spot. These are static posture traps. The fix is simple. Reset every 20 to 30 minutes. Stand up, do a quick stretch, or take a short walk. Your muscles and spine will thank you, and you'll drastically reduce the chance of another painful flare-up. And here's the most important part. You're not alone. Back pain can feel scary and frustrating, but by adopting these simple, consistent habits, you can dramatically lower your risk of it coming back. It's not magic. It's about small, daily actions that protect your back for life. So, start today, move a little, lift smart, stretch often, and protect your spine. Your back will reward you with freedom from pain, stronger muscles, and more energy for the things you love. Remember, these habits aren't just for recovery. They're for preventing back pain before it even starts. In summation, low back pain is a multifactorial syndrome arising from the biomechanical stress placed upon the highly articulated and load-bearing lumbar segment. The vulnerability of the myofascial envelope, muscles, ligaments, to strain or sprain makes these soft tissue injuries the most frequent cause of acute, self-limiting low back pain. However, more structurally significant pathologies involving the disc and nerve roots require careful differential diagnosis due to the potential for chronic pain and neurological compromise. Understanding the specific structural origins of the pain is paramount for targeted, evidence-based therapeutic intervention. Thanks for watching. Now you know the easy daily solutions to end lower back pain and take control of your spine health. But don't stop here. Smash that like button if this video helped you feel relief. Share this with friends and family who struggle with back pain. They'll thank you. Hit the notification bell so you never miss another life-changing tip. Subscribe now to join our pain-free community. Drop a comment below. What's your favorite back pain relief tip, or what exercise worked best for you? Let's inspire each other. Remember, small daily actions translate to big results. Start today, stay consistent, and say goodbye to back pain for good. I will see you in the next video.